Good day everyone, it's me Margarette, and for today's video, we'll have another fun activity that you can do with me. So I want you to join me as we first learn and palpate the surface anatomy of our lower limb, and second, demonstrate the different movement of our synovial joints. So what are we waiting for? Let us jump right into this video. So first, let us palpate the surface anatomy of the lower limb. To do this, I will demonstrate the location and try palpating the bone by following bone markings on yourself as well. So we have here first the greater trochanter of the femur. This is easier to locate in women than in men because of the wider pelvis. Also, it is more likely to be covered by bulky muscles in men. So, the greater trochanter of the femur is the most lateral point of the proximal femur, and it typically lies 6 to 8 inches of the iliac crest. So basically, the bone that you feel right here is not it. This is the pelvis, while just below it is the greater trochanter of the femur, the bone that you feel right below. Okay, so second is the patella and the tibial tuberosity. So let's feel the kneecap or the patella and palpate the ligaments attached to its borders. Going down, follow the inferior ligament to the tibial tuberosity where it attaches. So the bone below it is the tibial tuberosity. Okay, third is the lateral malleolus. Let's feel the bulge of the lateral aspect of our ankle, the joint of the distal fibula. I will show you. So this part is our fibula, and right below it, this part is the lateral malleolus. Okay, so for the lateral malleolus, this bone right here is the fibula, while this bulge aspect is the lateral malleolus, this part of our ankle. Then, the fourth one is the medial malleolus. Again, let's feel that part of our feet again, but this time in the medial protrusion of our ankle. Here lies the medial malleolus of our ankle. If this bone is the tibia, its distal point is the medial malleolus. So, moving on to the fifth one, which is the calcaneus. So, the calcaneus is also considered as our heel bone. By this, it is just easy for us to locate it. And I bet that just by mentioning the word heel bone, you can already guess and point out where the calcaneus is located at. Okay, so let me show you. This part right here is our calcaneus. So, try feeling the bone. Okay, so we're done with the first part. But before we move on to the next one, let us again recall and locate the bones we have just tackled about. So again, this is the greater trochanter of the femur, and then the patella and its tibial tuberosity, and then for the lateral malleolus is this part, and then the medial malleolus is this part, and then the calcaneus is our heel bone. Okay, now let's move on to the next part. So again, join me as I demonstrate the different movements of the synovial joints. But first, for everyone's knowledge, synovial joints are smooth cartilages that encase the ends of the bones. Together, the bones are protected by a joint capsule lined with the synovial membrane that produces synovial fluids. So, first on the list is the flexion. It is a movement generally in the sagittal plane that decreases the angle of the joint and reduces the distance between the two bones. Flexion is typically of hinged joints such as bending the knee or the elbow from this to this, or the knee from this to this. And also, it is also common at ball and socket joints such as bending forward at the hips. So from this to this. And also, you can do it also in your head from this to this. Second is the extension. It is a movement that increases the angle of a joint and the distance between two bones, such as straightening the knee or elbow again, from flexion going to extension, and then from this to this. Also for the trunk, from this, from flexion to extension. And then also from the head, from this flexion to extension. Fun fact, but wait, is Is it actually a fun fact? Because I think it is not considered fun if this one actually happens. But anyway, if extension is greater than 180 degrees, for example, bending the head or the trunk backwards, it is termed as hyperextension. I think you can only witness this in horror movies. Well, just kidding. We can also do it like this, such as bending the head or trunk backwards. Like that. From extension, going beyond 180 degrees, or also from the trunk, from this going that way. Now let's move on to the next one. Third is the abduction. It is a movement of the limb away from the midline or away from the median plane of the body, generally on the frontal plane or the fanning movement of fingers or toes when they are spread apart. So the key term to this is away. So from this, your hand will move this way. Fourth is the adduction. Movement of a limb toward the midline of the body. Adduction is the opposite of abduction. So the key term to this is into the midline. So from this, from abduction, going to adduction, into the midline. Again, from this to this. For the fifth one is the rotation. It is a movement of a bone around its longitudinal axis. Rotation is a common movement of ball and socket joints, which is also described as movement of the atlas around the odontoid process of the axis. Rotation occurs in the head, like this, and the vertebral column, this, and also in the upper limbs, from this to this, like that. And then also to the lower limbs, from this going that way. So basically, there are two types of rotation. The lateral rotation and the medial rotation, which can be applied to the upper and lower limbs. So the lateral rotation is moving away from the anatomical position, while the medial rotation is moving towards the anatomical position. So the lateral rotation will be away from the anatomical position and then going back to the medial rotation, which is moving into the medial line or the anatomical position. Sixth is the circumduction. I have confused this one with the rotation at first, but let me share to you their differences, and I bet it will just be easy to remember later on. So, circumduction is a combination of flexion, extension, abduction, and adduction, commonly observed in ball and socket joints, like the shoulders. The proximal end of the limb remains stationary at the distal end, moves in a circle. The limb as a whole outlines a cone. For me, it's like a whole rotation, wherein the joint really rotates in a full circular motion. Anyways, it is done like this. That is circumduction. The next one is the pronation. It is a movement of the palm of the hand from the anterior or upward facing the position to a posterior or downward facing position. This action moves the distal end of the radius across the ulna so that the two bones form an X. So basically, it is the rotation of radius in medial direction, leaving thumbs pointing medially to your body and the palms facing down or back. And this is done from the anatomical position to pronation, like this. So from this to pronation. And then the opposite of this one is the next one. So 8 is the supination. It is a movement of the palm from a posterior position to an anterior position of the anatomical position. During supination, the radius and the ulna are parallel. So basically, it is the rotation of the radius in lateral direction, leaving thumbs pointing away and the palms forward. So from pronation, going to supination. This is the opposite of the pronation, supination. From this to this. So for the ninth one, we have the inversion. It is wherein the movement that results in the medial turning of the sole of the foot. So inversion is done through this way. And eversion, the 10th one, it is a movement that results in a lateral turning of the sole of the foot. This is the opposite of the inversion. So if this is inversion, this one is eversion. This one is eversion. Well, did you know that these two can be the causes of ankle sprains when the movement is done forcibly, accidentally, consciously, or even consciously? Where, anyways, on to the last two. So 11th is the dorsiflexion. It is a movement of the ankle joint in a dorsal direction, such as standing on one's heels. The toes in this movement are pointing up as the superior surface of the foot moves forward. So for the dorsiflexion, from this to this. And the last but not the least, the 12th one, is the plantar flexion. It is a movement of the ankle joint in which the foot is flexed downward, such as standing on one's toes or pointing the toes. And then for the plantar flexion, going there, pointing downward. So this is the dorsiflexion, and then this is the plantar flexion. So that's it for this video. I hope you've learned something from this fun and interacting video activity. But keep in mind that you shall not do the synovial movements forcibly, accidentally, either consciously or unconsciously as well. You'll never know, it can cause sprain or worse. Anyways, thank you guys for watching. God bless you and have a blessed day ahead. Bye!